Hi, John Fitzsimmons. Yeah, love to hear passion and action. That was great. So I'm sitting in for Dr. Ruiz Matos, our regional advisor for immunization at the Pan American Health Organization. He had a health issue and apologized for being unable to participate today. I lead PAHO's Revolving Fund for vaccines. And as I began to put my thoughts together in terms of this panel discussion, I wanted to share with you some of the transitions that the national immunization programs in the Americas have gone through over the past 40 years. This is a 40-year anniversary of the EPI in the Americas. First was polio eradication, and Dr. Martin spoke to us earlier about polio eradication. The last case of polio in this region was 1991, certified free in 1994. Other than the commitment of the ministers of health in those days, USAID, Rotary, and others, and those partnerships drove the completion of polio eradication in the early 90s. And the reason for that is because that additional funding helped to develop the strategies of supplemental immunization activities, the surveillance systems that were mentioned earlier for AFP, et cetera. Subsequent to that, it was measles elimination and rubella elimination, most recently. CDC and other partners were very integral in helping that happen in terms of catch-up campaigns and other surveillance activities in the region. And then third has been the introduction of new vaccines with Gavi's support in the early 2000s through to today. And very quickly, there are 6 Gavi countries, and Santiago showed us the map earlier this afternoon, and you see Guyana and Honduras and others, Cuba and Haiti. By the way, Haiti 2 months ago signed an agreement to finance its own vaccines this year. And this was a result of partnership visit by all the partners collectively in August. And just two months ago, the Minister of Health and Minister of Finance for the government of Haiti signed this agreement with our director. And we hope to begin receiving their resources to purchase those products. These are traditional vaccines for the program in the coming weeks. So what were the key components to the success of the country immunization programs in the Americas? One, a plan, not just an annual plan, but a multi-year plan. And on top of that, a regional plan to support the technical cooperation that PAHO and the partners that I've been mentioning have been supporting the programs with. Two, a budget line and legislation to support the budget line. There are some articles written on the number of countries and you can access these articles that outline the types of legislation that the 30 or so countries in this region, including many of the Gavi countries, have that assure national financing of their vaccines. And three, a good management structure. Without those three, countries were not able to participate in a unique tool that the region has for providing access to vaccines. And this is where the private partnership component comes in, and that's through the Revolving Fund. So the Revolving Fund, the key to success with the Mercks, the Serums of India, the Korean suppliers, Green Cross and others, is a reliable forecast. To the extent that our forecasts for vaccines and syringes are precise, suppliers can then look at their commercial component and their supply plan to provide vaccines at the lowest price for the countries of this region. The other thing that's evolved is the capital fund for the countries of the Americas. This is now approaching $200 million. Each country has access to a credit line in which they can purchase vaccines for their programs, irregardless of their size, whether it's a Brazil, a Gabby country, a Guatemala, any of the participating countries have access to that. Looking ahead to our challenges, we have pockets of unimmunized children. We have transitions in terms of upgrading cold chain capacity and assuring delivery of quality vaccines to those point of services. We have challenges around measles importations and also keeping up our coverage for polio as well. In closing then, I'll just talk broadly about transitions in the sense of, and bring in a personal aspect. My wife and I have 3 adult children, and they traveled the world with us, first in Peru, later in Jamaica, and thirdly in India. And in each country involved with immunization programs. As adults, we are very proud of what they have accomplished and what they're doing in their own private lives, but they never really have left the nest too. We're still supporting them in some way, right? Grandchildren or otherwise, right? So we, in terms of addressing these challenges, whether it's cholera in Haiti, diphtheria in Haiti, measles for Haiti, measles for Venezuela, yellow fever in Brazil, and others, we are still there for these countries and their national programs. And then I'll just close by saying that the relationship with the suppliers is vaccine suppliers and syringe suppliers is a unique one, and one in which there's a lot of give and take and lessons learned in terms of suppliers understanding our approach to the business and our understanding their approach to the business. Last week, together with our colleagues from WHO, GPEI, and UNICEF, we made a visit to the IPV suppliers in Europe. We learned quite a bit, given the global constraints around IPV and global polio eradication. And so we, the supply chain runs from that production facility to that point of service. And to the extent that we can continue to build efficiencies on the private side and on the public side, we'll be creating greater benefit for the countries that we're serving. So thank you.
Thank you very much. That's great.